Okay. Hello, everyone. I'm Dr. Mercedes Okosi from the Coalition for the Advancement of Nigerian Mental Health, and we are back with another talk with an expert in our community, Adetowun Sogbein. She is a nurse practitioner in women's health, and we'll be talking a little bit about what the intersections are between women's health, reproductive health, and mental health. For all of us, for Nigerians at home and in the diaspora. So, welcome, Tone. Can you tell us a little bit about yourself?
Yes. Thank you for having me, Dr. Okosi. I am a women's health nurse practitioner, like you mentioned. Nigerian, lived in Nigeria for the first 12 years of my life and then moved to the United States, Chicago, Boston, and now New York City. I've been practicing as a women's health NP for about 6 years now. I've moved around from community health centers to sexual health departments. Now I do virtual care. So I just talk a lot with women about what's going on with their bodies. But different populations. I've worked with, more predominantly Black populations, but also just running the gamut, Hispanic, Latina, women, etc. So that is me in a nutshell.
Good to have you. So as you know, last month in March was International Women's Month, but we care about issues that impact women year round. Um, and on our talks, we've talked about different areas of mental health and infrastructure in Nigeria. We know that the healthcare infrastructure broadly is something that's lacking in terms of access and efficiency and funding. So particularly with women's health, we want to ask you a few questions about the impact that that has. Um, so first, where are there or where do you notice intersections between reproductive and sexual health and mental health, either with some of the things that you work on with patients or research that you're aware of?
Yeah, thank you for that. Yeah, so I mean, since I started practicing, it's become even more. I've become even more aware of how much I'm practicing mental health, and I always thought it was going to be uterus and very specific, but more and more so, I found that I've had to learn more about certain psychiatric conditions. So certain health conditions or reproductive health conditions are directly linked to mental health. So when we think of things like PMS, right? Um, and the more intense version, PMDD, so premenstrual dysphoric disorder, right, where a lot of women have, very significant mental health symptoms like anxiety, depression around their period. More and more people are becoming more aware of postpartum depression or postpartum anxiety or postpartum psychosis, right? Which is even more, yeah. And then also during menopause, right? A lot of women experience depression, anxiety. So certain health conditions they're almost entirely mental health. But also just how our hormones affect our different moods, right? During different parts of our cycle, whether or not we're aware of it, how we view our own bodies, how we view our sexuality. Um, a lot of that come into play. So yeah, I mean, in a lot of ways, it's interlinked in ways that many people are not aware of, or if they are, they just haven't moved it yet.
Yeah, and I think it's helpful that it sounds like, at least in your training and practice, and hopefully more broadly with nurse practitioners and healthcare people, that there's an emphasis on that. Because even on my side in psychology, I've seen people recently who did have significant mood and like behavioral issues around their cycle and often are just like trialed on different birth controls from their medical professional. Um, and when it becomes a chronic issue, then they come to see us for more of the psychological intervention. So I think it's a good thing that there's awareness on both sides that sometimes there are things that we need to send people back to medical and figure out the hormonal imbalance and the medical side. But definitely that link. Yeah.
Absolutely. Absolutely. And I think too that, with modern medicine, a lot of times, I mean, we're trained in the medication. So like you mentioned, birth control is a major one that we prescribe. But sometimes it can get more complex, more complex than a medication, right? If that fixes things, great. But sometimes that's just not enough. So then being aware of other things outside of medicine that, come into play with the mind body connection, right? Like you said, we send people back to, go see your psychologist or your therapist, etc. But also what kind of practices can you incorporate in your life that can help with that. So
Yeah.
mhm.
So we'll talk a little bit about, I guess, people's attitudes and approaches toward reproductive health, sexual health, women's health.
Yeah.
What kind of stigmas come up around this area? I guess you can talk a little bit about for Nigerian women specifically, for Black women more generally, people in the diaspora, what stigma comes up?
Yeah, so I've noticed, well, I should say that I haven't, I mean, every now and then I'll have a Nigerian woman patient, but, a lot of times, especially when I worked with more Black women, it was mostly African American. And when I worked in Harlem, it was mostly Senegalese women. But there are certain things that I can extrapolate from some of these communities. So a lot of
Mm.
cultures that tend to be more conservative, right? There's certain trends, right? And so, um, beliefs around birth control, for instance, that tends to come up, right? Whether a woman believes that she should be on birth control, whether she should not be on birth control, right? If she's sexually active, who she thinks what is acceptable and what is not, right? So if you're more conservative, right, a lot of them believe that's, you should only be sexually active within the context of marriage. But then what happens when your behavior doesn't align with that belief? Um, and so a lot of times I notice that a lot of things that are, things that are more taken for granted in the United States, people or a lot of people just tend to believe a certain way. You see that with more conservative cultures, especially people that are in the diaspora, right? There's this conflict of, you have one foot in one world and one foot in the other world and a lot of internal conflict.
Mhm.
So a lot of times people don't necessarily seek the care that they need because they haven't come to terms with their behavior and whether or not that aligns with their beliefs. And unfortunately, right, that's an issue because if you're not getting the care that you need, for instance, STI testing or
Mm.
certain general checkups or getting on birth control when you don't want to have kids, at least at this time in your life, then it sort of comes up. So that's generally what I see when it comes to stigma. It's just, if your beliefs and your actions don't align, then you're probably not going to be doing the things that would probably benefit you long term.
Yeah, that's interesting that like in a new context, especially if someone's like a new immigrant or even someone with immigrant parents who's been pretty like still ingrained in that culture, if like you said, beliefs don't align with behavior as maybe you're in the new context of the US, you have different influences around you, so maybe you are acting differently
Right.
um in terms of like not being constantly surrounded by just everyone reinforcing the same values, being curious about things, having maybe peer pressure, and then maybe feeling shame that like going and seeking treatment is admitting I've done the thing that I was not supposed to do.
Yeah.
Um,
Yeah, yeah, I
yeah.
agree. I mean, even it runs. I like that you said peer pressure. So it's this wide age range, right? I see it in the adolescents, the teenagers, right? The ones that believe that they should be on birth control because they know what they're doing, right? And maybe their parents are, they're like, absolutely not. You shouldn't be on that. So
Mm.
I've had some teenagers that have come for birth control, and they're like, my parents don't want me to be on it, but I want to be on it because I know that I need to be on it. And even all the way to women, midlife, right, where they think that, my mother didn't have to go on hormones for menopause. She went through the hot flashes, so maybe I shouldn't be on it, but I'm suffering. And a lot of women around me said it worked for them. So, so I just see that conflict just all around, right? Whether it's peer pressure, cultural pressure, but also, dealing with your own body and trying to listen to that too. So, yeah.
Yeah, thank you for that. Next, I want to talk a little bit about the more cultural and traditional side. And of course, even in Nigeria, with all of the different ethnic groups, there's wide variation. But I think there's opportunity to take the offerings of the advanced research in medicine and mental health, but also honor some of the traditional things. So, what traditional practices promote physical and mental health for people at all stages of reproductive care or birthing. For example, I know in Igbo, the traditional omugwo is
Yeah.
when like the mother of the new mother, either her mother or if her mother's not around, an elder woman, it's kind of like a set ingrained expectation that like this is an important moment. Someone is going to physically come and help you and be there with you as you learn for the first time how to be a parent. And then in return, the auntie or mom or whoever that comes to help is appreciated and gifted. And it's like built-in support and then also like modeling and learning for the first time. Like we're a community of women who've done this. You're new, we're welcoming you, we're teaching you. What are other things like that that people can continue to practice or incorporate?
Yeah, that was the first thing that I thought of. That was the first thing. I actually didn't realize that that was the name for that until yesterday when I was speaking to an Igbo friend of mine, because Yoruba people do that as well. So it seems to be, I mean, it's pretty predominant in Nigeria at least. And it's really, really important. I mean, it's not a it's not a coincidence that postpartum depression and anxiety is so prevalent in the United States. And then you go to a place like Nigeria and it's practically unheard of, right? Because it's so important, right? When it comes to is a new mother sleeping, does she feel like she's doing the correct things, right? Because that's a source of anxiety for a lot of new mothers, right? Like they're doing all these things, but they're still so scared that they're going to drop the baby.
Mm-hmm.
Am I doing the right things? Or, sometimes women also get conflicting information too. So for the longest time, or even till today, a lot of people still tell new mothers that you shouldn't hold the baby too much because then the baby becomes, too dependent. And it's frankly, it's the most ridiculous thing I've ever heard because the baby is supposed to be it's a baby. But then you see all these African women who, wrap the baby around in their back and they constantly carry the baby around and they're able to do things while the baby is still getting that, physical touch that they need. It's so important
Mm-hmm.
in mental wiring, right? And now we see the more fancy ones that, a lot of American women, but it's the same idea of just, we say you're backing your baby, so you put your baby on your back. So intuitively, we already practice all these things that the West is now, or at least the United States is now, catching on and realizing is so important. Um, but also, even when I think of, midlife again, when it comes to women, right? When it comes to menopause, a lot of my patients these days are going through menopause. And for a lot of these women, there's a lot of mental suffering around menopause because there's this idea of loss, right? Losing
Mm-hmm.
estrogen. A lot of these women, they lose their metabolism, so they start to gain a little bit more weight than they used to. And, even sexually, right? Their sexual health, the loss of estrogen also affects that, whether it's libido or how comfortable sex is. And I've realized that for a lot of women, how they go through menopause depends on how they view their bodies and how they view the transition. So I've noticed, especially from my mother, that, when it comes to that time in life, a lot of Nigerian women view that as gaining wisdom, right? A lot of
Hmm.
starting to have grandchildren, right? So there's this idea of, I have all this experience that I can now pass on to the next generation. My mom was beyond the moon when she turned 60. She was so happy, right? And I asked her about that. And my mom she loves to talk about all this wisdom that she's gained. Like and I thought about that and I said, oh my gosh, that's such a different mindset from what I see a lot in the West. There's a lot of, I'm not as beautiful as I used to. Or maybe, a lot of women are not as vocal about it, but when they talk about the weight gain that they're feeling, that's part of it, right? Is this holding on to what they think their bodies should be doing or how they should be presenting to society versus what is actually happening. And so I see a lot of what I think is unnecessary mental health suffering um, based on how people view that transition. So I think celebrating that transition, whether it's adolescence or menopause, the idea of celebration versus what is going on, confusion, isolation, loss, mourning, it makes a massive difference.
Yeah, that makes me think of like the cultural difference. Um, and I don't know if it's as broad as like Western countries versus just a lot of like African and Asian and other countries in general. But I'll say Nigeria specifically, there's different attitudes around age in general. Like in in the US, I'll say specifically, there's like an urgency and then like such a prioritization of preserving your youth at all costs. Like 40 is the new 30 and 30 is the new 20, and do this skincare and get these procedures and these surgeries. And like if you're a woman over 25, you're done, and all of the things that we hear.
Yeah,
Whereas I think in cultures where there's more of a reverence for elders,
right.
there's like you're reaching a milestone of like, I am now one of these people at this stage in life that can be honored. And I'm not like finished and to be thrown away. Or even that like my sole purpose as a woman is not just to be in reproductive age and be someone's mom, you know?
Absolutely, absolutely. I
So
agree.
that's a good like cognitive reframe of
Yeah,
celebration instead of loss.
yeah, yeah. And I hadn't articulated that, right? Is cultures where they hold reverence for elders. That's perhaps the difference because the closer you get, now it's not always the case that people gain so much wisdom as they approach, but it's nice to it's nice to have that association. It's something to aspire to, increasing. Yeah. So so I completely agree. And I also find that the more exposed, body image, that's a major thing, right? And so we're finding now that even outside of the West, right, as people become more exposed to certain media, right, and start to
Mhm.
take on some of these ideas, right? So I think there's a very narrow idea of what is considered the standard, right? The standard of beauty when it comes to bodies, right? In in a lot of African countries, right, bigger bodies are still very much appreciated.
Mhm.
But that's not necessarily the case when you engage in, I mean, things are starting to shift, I hope, in the United States at least, but it's still very prevalent. And um, then you start to see certain countries outside of the West that are now starting to take that on, right? It's now starting to narrow the idea of what is considered beautiful, and that also has a lot of play on our mental health, etc. So
Yeah.
yeah, doesn't benefit
Yeah.
anyone.
All right. Are there any unique barriers that Nigerians in Nigeria or abroad have in terms of access to reproductive and sexual health care or women's health care?
Yes. So information is a major one that I would say, just knowing what is available, what is not, and what is strange generally, or if we view something as strange, then we're less likely to trust it, right? So the major one that I see a lot is contraception, right? So knowing what is available. Most people know about the pills, but a lot of people don't know about the patch, the ring, the injection, the implant, the IUD, etc. And it can feel overwhelming, uh, for a lot of people. But also, if something just sounds strange, then you're more skeptical about it. And so, when it comes to, I mean, I don't know what access Nigerian women in Nigeria have to that sort of information. I would imagine maybe even less than what I see here. Um, but also just when it comes to hormones, right? There's a lot of information out there. You go on TikTok, I see all manners of things, and I'm like, that is not correct at all. But that's what a lot of people are seeing on their feeds. But then I think of specific health issues that affect more Black women, and so things like fibroids, for instance, right? Benign growths, non-cancerous growths in the uterus, but a lot of women have really heavy periods, really painful periods, sometimes really long periods. A lot of women lose a lot of blood. Sometimes people need transfusions. I mean, it can get really bad. But then when your mother has gone through it, your aunts have gone through it, right? Your friends are saying, oh, yeah, periods are really bad. Then you start to think that that's just the norm. That's just what you have to go through having a female body. And you take that and you add it to lack of information about what's available. So for instance, contraception that can lessen your bleeding, right? Can lessen your pain, right? You don't have to go through so much pain, etc. So when you take that, you can see how a lot of women and girls just suffer unnecessarily because they just don't have that access to information, right? And the more access they have, the more you know about something, perhaps the more comfortable you get about it. So
Mhm.
that the education piece is usually really important. It also helps. I found that it really, really helps, you know, representation, right? So when I'm talking to a Black woman or an African woman or Nigerian women, right, a lot of them express that they feel more comfortable with the information that I'm giving them. They trust it more than,
Mhm.
let's say, they were getting it from someone who they don't necessarily trust or who they think views them as just another patient or another number. And so that representation matters as far as getting that information out there and making sure that people, at least trust the source of the information. Whatever they decide to do with it is, it's, of course, it's their business, but at least they have that information.
Yeah,
Yeah.
that makes me want to ask now too, because you said you lived in Nigeria until age 12, right?
Yes.
Um, a lot of the like sexual education in the US, depending on state, is not the best.
Hmm.
Um, so in terms of being in a country that has all of these resources and claims to be, the most advanced in a lot of ways, um, I'm wondering then in a place like Nigeria where we are developing and fixing infrastructure and education in all these areas, what is the sex education like, if any? Whether you know firsthand or have older siblings or cousins or people who would say what their
Yeah.
experience was like.
Like right now, as opposed to, I mean, I can make an educated guess because I don't know specifically. I know as recently as maybe a year or two ago, we were trying to do some sexual health education in Kenya. And in a lot of, Kenya is very similar to Nigeria a lot of times in their conservatism. And,
Mhm.
you know, so what they would allow, right, in the schools for us to talk about, it didn't matter what age, certain things like hygiene, for instance, right? Everyone is in agreement.
Mhm.
It's important for girls to know how to use pads, etc. How their bodies are changing. So that was allowed. When we started to get into contraception, that's when things started getting a lot, very dicey, right? At what age should we even be mentioning birth control, right?
Mhm.
Um, so that became an issue. And, a lot of times they didn't want us talking about birth control until people got into college, right? I mean,
Mhm.
but then there's a question of, you know, on average, when are people becoming sexually active, right? It makes sense to start the conversation before they get sexually active. Um,
Mhm.
and so there was a lot of that, and even, conversations about sexuality in, at least in certain states in the United States, it's acceptable to talk about sexuality as early as middle school, or maybe even grade school sometimes, right? But that wasn't a conversation that was allowed because general idea is that there is only one acceptable sexuality. There's only one acceptable way to talk about gender. And so I just find
Mhm.
it does people a lot of disservice. I mean, maybe it's changing in Nigeria, I would hope, but if we're waiting till college, I mean, some people don't even make it into college, right? And these are the people that are maybe at higher risk of
Mhm.
um, unintended pregnancies, etc. So it's just in general, it's very much lacking. We'll talk to women, when they come in for their prenatal, right? That's when a lot of people will talk about contraception right after the fact, but not, not before.
Yeah. Yeah, and I think that can be a really stressful and confusing experience for people sometimes. Like you hear stories about girls who their mom never told them anything about menstruation until it happened and they thought they were like dying because they were bleeding, or
Mhm.
just even being able to, I think sometimes maybe parents or people in society are worried that like if given the information or the tools, kids will overuse them or be even more curious and be reckless. When usually the fact is that if you teach kids about safe sex and give them condoms, they are not going to do it more than they would have. They'll do it safer, at least if they do it.
Absolutely.
Um, And in terms of just being able to be equipped with the knowledge so that if you are in a sexual situation earlier than you want to be, you can feel some sense of agency and know your body and say, no, this is not what I want to do, you know?
Right. Right. I agree. Knowledge is power. Um, and that's a very good point, right? Like with the parents, for instance, there's so much taboo. A lot of times parents also feel really embarrassed about talking about these things. There isn't this culture of an open conversation about it. Um, and I think that, to your point, I think that if parents realize that regardless, your kids are getting some information, the question is, where are they getting that information from? And are you comfortable with the kind of information that they might be getting, outside of it? So whether or not we're talking to young kids, they're talking to each other. And a lot of times it's just a lot of misinformation, but they're just doing the best that they can, right? Even
Yeah.
something, I'm going to get graphic, even something like vaginal discharge, right? Where a lot of kids, if you don't talk about it, that's one that gets left out of the conversation. But at least with girls, when you enter adolescence, you start getting that. If she hasn't heard about it, she's thinking maybe this is dirty, this is something that's bad. Why is this happening to me? But it's such a simple fact of life that if you don't talk about with your kids, they're just not going to know what's going on. Um, and so, yeah, I think that perhaps maybe that's another part of education that's lacking, is teaching, at least getting parents more comfortable with having these conversations with their kids.
Yeah.
The kids are having the conversation anyway.
Yeah. All right. Any other pieces of education or advice that you would share with our audience or last thoughts?
Yeah, I mean, I think I would encourage, especially Black people, Black women, to find healthcare providers that they feel really comfortable with. It's not just getting a PAP, marking that off, getting a mammogram, marking that off. Is find someone that you feel comfortable with, you trust that they have your best interest at heart, you feel respected by them, because a lot of people get a lot more out of their healthcare when they trust their providers, when they're having open conversations, and also realizing what is available, right? Like I said, a lot of unnecessary suffering, whether it's menopause or postpartum or menstrual periods. It's a lot of unnecessary suffering because a lot of people just don't have the information, and they view their healthcare provider as this God who just gives them what they recommend, and then they just go about their way. And that's just not, I don't think that's the best way to go about healthcare. So find someone that you trust so that you can get that information that's true, right? Or you even get second opinions versus getting your information from, word of mouth or social media. Good advice.
Yeah, thank you for everything. This is a great conversation. Hopefully a start to many more conversations people will be inspired to have around this. Where can people find you if they want to see more of you?
Yes, so I just blanked on the name. I recently started an Instagram um, blog, but I need to update it more. It's about women's health, just general information that a lot of people don't talk about. So it's called Your Friendly GYN. So you can find me on that. Um, Eventually, hopefully, I'll start a website or a YouTube channel where we can talk more about it. But in the meantime, Your Friendly GYN, whether it's adolescence, midlife, just runs the gamut of women's health.
Great, thank you so much.
My pleasure. Thank you for having me. I really enjoyed this.
Okay.